Welcome back to Study Med. Today we will discuss about ECG. So mainly for ECG, first of all we should know what is ECG. ECG is electrocardiograph. And for that we must for predicting this complex PQRS complex, T wave, P wave. For that we must have some basic knowledge how this electric conduction is going in heart. For that we will say that this SA node where it is located in the lateral wall of right atrium. This SA node will depolarize first and it will send impulse to right atrium, left atrium and this AV node also. And from AV node this electric impulse will go to this bundle of His. From bundle of His it will go, this impulse will go to the Purkinje fiber. From Purkinje fiber this ventricle will depolarize. So this is happening in whole QRS complex, whole ECG. So this phenomena will go on and we will see this ECG and we can record this activity on ECG. So for that we will see ECG. In ECG we know that yes, we have idea that this is P wave, this is Q wave, this is QRS complex and this is P wave, here PR interval, then Q wave, then this is QRS complex and here T wave and this U wave. For that we must know what is P wave represent. So P wave represent arterial depolarization. P wave represent arterial depolarization and we started from here only. SA node depolarize. So when SA node will depolarize it will generate P wave. So wherever if you will see this P wave in ECG it means that it is sinus. So this is SA node and arterial depolarization. P wave will represent arterial depolarization. That from P wave we can see this isoelectric segment and that is very for little time. Before starting of Q wave we can see something that is very straight. That is we can say that it is PR interval. And what PR interval is representing? PR interval is representing AV nodal delay. AV nodal delay means that how much time it is taking from arteries to traveling to the ventricle. So this is AV nodal delay. After that it will reach ventricle and from ventricle we can see this QRS complex. And QRS complex will represent this ventricular depolarization. And from QRS complex we can see this, again we can see this isoelectric segment and this segment is known as ST segment and it is always isoelectric only. And then we can see this T wave and T wave represent ventricular repolarization. And most of the person normal person also we can see this U wave also. This U wave represent delayed repolarization of papillary muscles. It is normal. Sometime in some cases we can see this U wave prominent and I will tell you further that where we can see this U wave prominent U wave. So for first the basic thing was what you need to know, that what P wave represent, what QRS complex is representing, for what T wave is, for what PR interval. This is the basic. So we will see it again. P wave represent arterial depolarization, PR interval represent AV nodal delay, this QRS complex represent ventricular depolarization. Yes, and QRS complex at the same time when ventricle is depolarizing, at the same time arterial is repolarizing. So arterial repolarization is also representing by QRS complex only. And then this T wave represent ventricular repolarization and U wave represent delayed repolarization of papillary muscles. Now we will go for ECG. In ECG, when you will see this ECG, this complete one large box, there is 5 small box and one small duration of one small box is 40 millisecond. Now you will tell that why I am telling you this. For this for the duration of P wave QRS complex we must know that what is the normal duration of one box. So the one box represent 40 millisecond. And this complete one big box will represent, one large box will represent 40 multiplied by 5, that is 200 millisecond. Okay, let's go further. This ECG is representing normal sinus rhythm. Why I said sinus? Because we can see that here after first P wave, then QRS complex, then T wave. So we can see that P wave is, we can see P wave everywhere, P wave present. So if P wave is present, it means that it is sinus. If P wave is present, it is sinus. So I told you this rhythm is sinus. Okay. In this P wave, what I told you what P wave is representing? P wave is representing arterial depolarization. And what is the normal duration of P wave? It should be less than 120 millisecond. Okay, if it should be less than 120 millisecond, it means it should be less than 3 small squares, because one small square represent 40 millisecond. So 3 small squares represent 120 millisecond. So approximately we will say that this P wave must be into this 3 small squares only. So if it is the small square of this ECG, I will say that this P wave must be in this limit only, in this 3 small box. So normal duration of this P wave should be 3 small square. And vertical height means how much this amplitude, like if it is P wave from here to here, what is the height? This is known as vertical height. And what is the normal height? We must know that vertical height of the P wave, it should be less than 1.5 millimeter in chest lead. It is very important to know, because when we will read about this pathology, this will help a lot. So this is the basic knowledge what we must know. Okay, let's go further about PR interval. Okay, I told you PR interval is showing AB nodal delay. So PR interval is AB nodal conduction, and always keep this in mind, always keep this in mind that PR interval is inversely proportional to heart rate. It means if how much time it will take from atria to ventricle, that much low will be the heart rate. If PR interval is more, it means heart rate will be less, or if PR interval is less, heart rate will be more. So normal duration of PR interval should be 120 to 200 millisecond. 120 to 200 millisecond. It means that it should cover 3 to 5 small boxes only. If I will say that this is the small box of ECG 4 or 5. So this PR interval, it means P, this isoelectric line, and from this QRS complex, and then QRS and T wave. Okay, so from here if we will go, so this PR interval is not from P to R. Just clear one thing, that PR interval, it doesn't mean that it is the interval from P wave to R wave. No, it is the interval from this P, end of the P and starting of the Q wave. It is the interval from end of the P and starting of the Q wave. That's it. This is PR interval. Not from starting of P wave, not in the starting of R wave. No, it is from the end of P wave and starting of this Q wave. This is the PR interval, and it should be 3 to 5 small boxes. Okay, let's go for Q wave. What does Q wave indicate? Q wave indicates septal depolarization. What is this septum? Here we can see this bundle of fish, and bundle of fish is divided into right and left. So this is the septum. And here what depolarization is taking place, that represent Q wave. And the normal duration of Q wave should be less than 40 millisecond. 40 millisecond means one small square. It means that this Q wave should be in the limit of this small box only. This small box only. If this is the small box, Q wave should be in the limit of this only. And depth of the Q wave should be less than 1 millimeter depth. Okay, if depth of the Q wave increase, it shows that it is myocardial infarction. In many cases, you will see this ST elevation and other things also. And this Q wave depth not only increasing in myocardial infarction only, in other causes also. But I told you specifically in myocardial infarction because we are studying this topic a lot. So what is going in this QRS complex in myocardial infarction? It should be in one box only, but in myocardial infarction, this depth will increase and it will cover more than one small box. So the area, like if we will say that uh, boxes, it will cover more than one small box and the depth will be more. So even if and this we can see, even if this myocardial infarction will resolve also, we can see that this depth will be present there for forever. If once this QRS complex depth will increase, it will never ever will be normal. It will never go back to normal. So this is the fact. If you will see anyone's ECG, if you will see there that QRSQ complex is so deep, it doesn't mean that he is suffering from myocardial infarction. It can be that he had stroke before, he had infarction before, and that Q wave is resembling. Let's go for QRS complex. This QRS complex represent ventricular depolarization, and this ventricular depolarization normal duration should be 80 to 100 millisecond. 80 to 100 millisecond means it should be 2 to 2.5 small box only. It means if this is the QRS complex, so it should be between 2 or 3 small box only, 1 and 2 or 3. So it should be in between 2 to 2.5 small box only. If it is more or less, I will tell you about this, like if QRS complex is broad, it is bradycardia. If QRS complex is narrow, it is tachycardia. We will see it later, but for this time just read about the normal duration. And then go for QT interval. QT interval will show ventricular depolarization and ventricular repolarization. Let's come back to this ECG. Here, QT interval means from here, QT interval means from here till here. It means QRS plus T, na? QRS plus T. It means QRS represent ventricular depolarization and T wave represent ventricular repolarization. So this QT interval, it is showing ventricular depolarization and ventricular repolarization. And normal duration for QT interval is 360 to 440 millisecond. It means 9 to 11 small boxes. Approximately you can say 10 box. And where this QT prolongation will occur? QT prolongation we can see in the case of hypokalemia, that is Torsade point. So, and it will cause arrhythmia. We will see about this pathology later, but for this time I just mentioned it. An ST segment, what I told you, it must be isoelectric line only. What is this ST segment? We will come back here again. This is the ST segment. And you are studying this in myocardial infarction, that whenever we have ST segment elevation, we can say it is myocardial infarction. We will study this also, but for this time I am just mentioning it. And T wave represent ventricular repolarization and height of T wave. That is must, like in T wave we will not read about the duration, but we will read about this height, because it is important that somewhere you will see this tall tented T wave and small T wave. So it is in electrolyte imbalance. When we will study this electrolyte imbalance, we can see this tall tented T wave or small T wave. There it is so much important that you must know the normal limit. In limb lead, it should be less than 5 millimeter, and in chest lead, it should be less than 10 millimeter. Overall, let's discuss, like we discussed all these intervals. So if we will go for this summary, P wave normal duration is 3 small squares. PR interval, it should be between 3 to 5 small boxes. QRS complex, it should be between 2 to 2.5, and QT interval is 9 to 11 small squares. So this is the normal thing what we must see in ECG. Okay, let's see this ECG. Here we can see this P wave again, P Q R S T. Go for again then P Q R S T. So now this is here, by seeing this P wave only I can say that it is sinus. Okay, this is sinus and regular also. So first step, whenever we are seeing this ECG, what we must see? We must see this P wave is present there or not. Yes, first step is see P wave. If P wave is present, we can say it is sinus. If it is not present, we can say it is non-sinus. Second, go for this RR interval. If RR interval is regular, we can say it is regular. If it is irregular, we can say it is irregular. If the distance between two RR wave is not equal, we can say it is irregular. Here we can see 1, 2, 3, 4. This one is R, this one is R, this is RR interval. 4. Here if we will go from here to here, 1, 2, 3, 4. Here also you can see 4. 1, 2, 3, 4, 4. It means it is regular. Second step. Then third step is calculate heart rate. How we are calculating heart rate? In every ECG you will see this all lead, and in the down always there will be second lead. And from second lead only we are calculating this heart rate. Not seeing all but second lead. This is the lead where we are seeing this heart rate, and this lead is known as rhythmic lead. Second lead is also known as rhythmic lead. In second lead we will go and see this heart rate. So how to calculate heart rate? In heart rate we must count this large square. Like what is the large square between two RR interval? If here I will go, this is R, this is R. Now third step I am calculating this RR interval. 1, 2, 3, 4. Approximately 4 large square is there. So what I will do, I will divide this 300. I will divide this 300. This is the formula. 300 divided by RR interval. So 300 divided by 4, that is 75. According to that ECG, the heart rate is 75 per minute. So what is the normal heart rate? Normal heart rate should be 60 to 100. If someone who has heart rate is less than 60, it is known as bradycardia. If someone has heart rate more than 100, it is known as tachycardia. So if less than 60 bradycardia, it means the duration between two RR interval is more than 5 large squares. If more than 100, it means that the duration between two RR interval is less than 3 large squares. After this seeing the heart rate, we must see that deviation, axis deviation. For this axis, first of all we must know that normal axis of heart is between -30 to 110 degree. In left axis deviation, angle will be more than 30 degree. In right axis deviation, the angle will be more than 110. How to see this? First we will make this graph, and here you can see this one is the lead one and it is lead AVF. Here according to math we know that this side will be plus and this will be minus. And here it should be plus and it should be, here it should be plus, it should be minus. But in medical it won't work. We must remember that this lead one is positive according to math, but it will be opposite. Here it should be positive. According to math it should be positive, but here it is negative, and down one is positive, and this one is also positive. So if it is positive, we will say it is 0 degree, it is plus 90, minus 90, plus 180. So normal axis should be between -30 to 110. And if we will go for this vector should be in between somewhere. So if any axis will be between -30 to plus 110, we will say that it is normal axis. But if the graph will come here between, like if it is more than -30, we will say it is left axis deviation. And if it is more than 110, we will say it is a right axis deviation. And if some axis will come here exactly opposite to the normal axis, we will say this extreme axis deviation. We will say it extreme axis deviation. So now you will say, oh, what is this? It is so complicated. Okay, let's go for the quick method. In this, what we need to do, like 95% or 98% time, this quick method will work. First of all, just see AVR. This is the AVR, and it must be negative. Always and always it must be negative. If it is not negative, then suspect that limb lead is reversed. Someone kept in wrong way. So here we can see this AVR. We can see this AVR wave. It is negative. So yes, it is normal. Now go for this axis deviation. What kind of axis deviation is there? For that, you just need to see lead 1 and lead 2. Normally, lead 1 should be positive and lead 2 will be positive only. So in normal axis deviation, lead 1 and lead 2 both should be positive. We can say it is normal axis deviation. For left axis deviation, you just need to focus on lead 2. Left axis deviation. In left axis deviation, just go for 2. And by the trick only you will get to know left t t t in Hindu t for 2. Left, just go for lead 2. So in left axis deviation, see, lead 1 should be positive and lead 2 will be negative. By seeing it only, you will say that it is left axis deviation. And what will be in right axis deviation? Lead 1 will be like it is opposite than left axis deviation. In left axis deviation, you are seeing that lead 2 is negative. Here lead 1 will be negative. In right axis deviation, lead 1 will be negative and lead 2 will be positive. So this is right axis deviation. So these all are the basics of ECG. These all are the basics of ECG, and we will discuss about the pathology in the next video. I hope you guys like it. If this content is helpful, please mention in comment, and please tell me on what topic should I make next video. And if you like this channel, if you like this video, please subscribe, like and share. Thank you. What are the basics of ECG, and we will discuss about the pathology in the next video. I hope you guys like it. If this content is helpful, please mention in comment, and please tell me on what topic should I make next video. And if you like this channel, if you like this video, please subscribe, like and share. Thank you.